You know that feeling you get a prescription for an antibiotic, but what's actually in that little bottle? And what does it do? Well, today we're pulling back the curtain on a really common one, Cefdinir. We're going to break down how this thing actually fights off an infection. Let's dive right in. I mean, seriously, have you ever really thought about it? How does a tiny pill actually go to war with an infection inside your body? You just take it, and hopefully a few days later, you start feeling better. But what's the microscopic battle plan? How does Cefdinir actually win against all those invading bacteria? Well, that's exactly what we're going to get into. All right, so first things first, what is Cefdinir? Well, think of it as a powerful weapon your doctor can prescribe. It's part of a family of antibiotics called cephalosporins. And the key thing to know is that it's broad spectrum. That just means it's not like a sniper rifle built for one single target. Nope, it's more like a really versatile tool that can take down a whole range of different bacterial bad guys. Okay, let's get to the really cool part, the main event. How does Cefdinir actually win that war inside your body? We're about to look at its very specific, four-step mission to basically take bacteria apart. All right, check this out. It's a brilliant strategy. So step one, picture a bacterium like a tiny fortress, okay? It's protected by this really strong, rigid cell wall. Now, for step two, Cefdinir has one mission. Find the construction crew, the machinery that builds and repairs that wall. This is where the sabotage comes in, step three. It finds those special wall-building enzymes and just jams them up completely. It binds to them so they can't do their job. And the result? Step four, the collapse. The wall gets weaker and weaker until it just can't hold anymore. The whole bacterium just bursts. Game over. It's a really direct and, honestly, a pretty brutal way to take them out. So now we know how it works, which is pretty amazing. But let's talk about what it works on. Cefdinir has a very specific hit list of infections it's designed to go after. Okay, this next point is probably the single most important thing to understand about any antibiotic. Cefdinir is a bacteria killer, period. It is completely 100% useless against viruses. So if you've got the common cold or the flu, this isn't going to do a thing for you. And taking it anyway isn't just a waste, it's actually dangerous. Why? Because it contributes to antibiotic resistance. Every time you use an antibiotic when you don't need it, you're giving the few tough bacteria that might be hanging around a chance to survive, multiply, and become superbugs. It's a huge problem, and it starts with using these drugs correctly. So, what is on that official hit list? You can see here, Cefdinir is a real workhorse for a lot of common infections. For respiratory stuff, you're looking at things like pneumonia, sinusitis, and that nasty strep throat. It's also a big one for middle ear infections, the kind that are super common with kids. And it even handles certain skin infections. It's this versatility that makes it such a go-to tool for doctors. Of course, with any powerful medication, there are potential downsides. You can't just talk about the good stuff. To really be an intelligent user, you have to know the side effects and the really important warnings. So, let's take a look at the fine print. The good news here is that for most people, the side effects are pretty mild and totally manageable. Diarrhea is the big one, it's the most common, and that makes sense, right? The antibiotic is messing with the good bacteria in your gut along with the bad. You might also run into some nausea, maybe a headache, a mild rash, or even a yeast infection. Usually none of this is a huge deal, but definitely talk to your doctor if anything gets really bothersome. Now this is a really important number to be aware of. Cefdinir and penicillin, they're basically chemical cousins. So, what that means is, if you've had a severe allergic reaction to penicillin in the past, I'm talking hives, trouble breathing, anaphylaxis, then there's about a 5 to 10% chance you could react to Cefdinir too. It's called cross-reactivity, and it's something your doctor absolutely needs to know about. Okay, everybody listen up. If you remember one single warning from this entire explainer, please let it be this one. You cannot take Cefdinir at the same time as iron supplements, multivitamins with iron, or antacids. Why? Because Cefdinir literally grabs onto the iron and the stuff in antacids, and when they bind together, your body can't absorb the antibiotic. It makes the drug way, way less effective, almost useless. So the rule is simple. Separate them by at least 2 hours. 2 hours before or 2 hours after. No exceptions. And speaking of that iron interaction, it can cause a pretty weird and frankly alarming side effect. But don't panic. If you take Cefdinir and there's iron in your system, even from something like iron-fortified baby formula, it can sometimes turn your stool a reddish color. Now, it looks scary, but it's really important to know this is not blood. It is not harmful. It's just a harmless chemical reaction happening in your gut. All right, let's wrap this up and bring it all together. To make sure you're getting the absolute most out of Cefdinir and using it safely and responsibly, there are a few golden rules you've just got to follow. Think of this as your mission checklist. Number 1, take it exactly how your doctor prescribed. Don't freelance. Next, and this is huge, you have to finish the entire bottle, even if you start feeling better halfway through. That's how you make sure you wipe out the entire infection. And of course, never share your medication with anyone. Ever. And remember the big safety warnings. Keep an eye out for any signs of a serious allergic reaction. And please, please always keep that 2-hour gap between your dose and any iron or antacids. And that really brings us to the big takeaway here. When you dig into just one antibiotic like Cefdinir, it makes you realize how precious these medicines are. They are truly life-saving tools. And every single time we use one the right way, for the right reason, and for the full course, we're not just healing ourselves. We're doing our part to protect their power for everyone in the future. It really makes you think, are we doing enough to guard these incredible resources for the generations that will come after us?